Our special guest is Dr. Jonathan Tarbox. Thank you for joining us.
Great to be here.
And you are the director, the head of Research and Development
yep,
here
at CARD, and executive director of the Autism Research Group, our new nonprofit. Also.
Awesome. Absolutely awesome. So we ask you to come in from time to time to look at things for us and tell us. I know I read things and media presents things in a certain way about research on the news, on the nightly news, and I look at it and I go, wow, that sounds fascinating, but I don't know what all the underneath stuff is. And a lot of times it isn't at all what it looked like on the evening news.
That's right.
And so I sent you a study, something that I saw this week that I was like, okay, this is interesting to me. But I want to know what the nuts and the bolts and how to make sense of it. Talking about mice and bone marrow transplants, mice who have some level of OCD. Mm-hmm. And my understanding, my rudimentary understanding of it, and tell me if I'm getting this wrong, that they had mice who were obsessively grooming themselves.
That's correct.
And they took the bone marrow from those mice and replaced it with the bone marrow from mice who didn't excessively groom themselves, and that overwhelmingly the mice who had this sort of OCD issue, that how they were claiming that it was, lost this behavior.
That's correct, yeah.
And then the other part that was really interesting to me was that then they took completely typical mice who didn't have this issue, took their bone marrow and put bone marrow of the mice who did have the grooming issue into those mice, and those mice now overwhelmingly started excessively grooming themselves.
That's correct.
So they were saying cause and effect.
Right, yeah, and that's always sort of a dangerous term to throw around. It's cause and effect or causal relation. But it is very interesting that they had a particular medical intervention that they did that resulted in increases or decreases in very particular behaviors, stereotyped behaviors, exactly along the lines that they predicted. So you put in this bone marrow from the disordered mice into typical mice, quote unquote, and they start doing this obsessive behavior. Whereas if you put bone marrow from typical mice into the mice with this disorder, that actually decreased the obsessive behavior a lot. So it is really compelling to see a very clear behavioral effect of a medical intervention. So it is kind of interesting. However, it's important, especially with any research that uses animal models of a human disorder, it's very important to be cautious about how you interpret the findings.
Yeah, and I think, what was interesting about it to me is that, I was telling somebody else about this and they were saying, but are they saying that this has some relationship to autism? And I said, well, I think I found it on an autism site, which is a little scary to me because mice excessively grooming themselves, how much does that actually have to do with autism? How big of a leap are we making here?
Well, there's a lot of leaps. So first of all, let's get back to sort of the basic rationale behind animal models of any disorder.
Okay.
The hope is when you create an animal model of a disorder, the hope is the actual cause and effect or functional relations in the real disorder are replicated in the mouse model of the disorder. Okay, so for example, we have mice that obsessively groom themselves, and that looks a lot like OCD behaviors or trichotillomania, which is just the fancy word for pulling out your own hair.
Right.
And so it looks at sort of at the level of topography, or at first blush, it looks similar, right? The two organisms are doing the same behavior. So you might think, well, that's a great model. But what's much more important than simply displaying the same behavior is why the organism is displaying the behavior.
Right.
So let me give an example that I think we could all be familiar with. Let's say we wanted to create a mouse model of tantrums. Let's say we want to understand how tantrums work in people with autism. So we create a mouse, a genetic variation of a mouse that throws lots of tantrums. Okay. Would that be a reasonable model of tantrums in people with autism? And the answer to that would be, well, only if the tantrums occur for the same reasons that tantrums occur in children with autism. So we know a lot about why tantrums occur in children with autism, right? Sometimes it's to get attention, sometimes it's to escape from doing non-preferred tasks or work, sometimes it's to get access to something that they want, some kind of item or activity, sometimes it's to get access to the opportunity to be in control or be the boss of the situation. So we know that there's lots of different reasons why tantrums, why they occur in children with autism. So let's say we made a mouse model of tantrums, but it was only due to one of those reasons. And then we developed a treatment to cure that in that mouse.
Right.
And then we say, oh, well, look, it worked. Well, is that going to work now with my 3-year-old son with tantrums? Well, only if it's happening for the same reason, you know.
Right.
So, and what we know from functions of behavior is you can actually make a behavior worse if you're not directly addressing the function. So it's very, you have to be very skeptical and very careful when doing animal models of any disorder. One thing to keep in mind too is a major component of obsessive compulsive disorder is the obsessing part. It's not just the outward compulsive behaviors, the repetitive behaviors, but it's also the thinking repetitively and obsessively about particular topics. So there's lots of thinking, there's lots of worrying, anxiety going on that may or may not be there in mice. As far as we know, mice don't sit around thinking about the future and worrying about the future.
Right.
So if that thinking and worrying component is actually an important part of OCD, then that entire aspect of that disorder is not being represented at all in the mouse model. So that might even be the most important component. We don't know, right?
Yeah, absolutely.
So we need to be very careful when constructing animal models of anything, especially if it's a disorder that involves complex human behavior, such as thinking and worrying.
Right. So nobody sat down and asked the mice, are you worried about something and that's why you're pulling your hair? And after they stopped doing it, nobody said, and what's your anxiety level right now?
Right. And that research, by definition, can't be done because we can't ask mice if they're worrying. So.
Right. Unfortunately.
Yeah.
Isn't that a bummer?
But I do have to say, it's an exciting study, and it does implicate the immune system and immunological dysregulation or whatever you want to call it in OCD and potentially in autism. And so this is one of those things where a responsible researcher says, okay, this is the first step in, first step out of 1,000 steps that need to be taken before we can actually help somebody. And I think that is actually what these researchers are saying. They're not saying we've cured OCD.
No.
They said that we might have found one particular component in the overall complexity of the disorder that might have a causal relationship.
Right.
So a lot more research needs to be done before we know.
And I think that's really indicative of how research gets rolled out to us as consumers, is that, there'll be some little thing that suggests that more studies need to be done, and yet the media blows it up and we all feel like, well, and why aren't we seeing that pill on the shelf already?
That's right.
If they found it.
And, as ABA folks, we got to keep in mind what everybody's source of reinforcement is and what everybody's source of motivation is. And for the media, maybe this sounds jaded, but their source of motivation is to get the most attention to their articles, right?
Absolutely.
That's how the paper or the internet or the website or whatever, that's how they survive, is through advertising revenue. And the only way you get advertising revenue is through attention.
Right.
So they can't, if a media outlet wants to survive, they can't report science accurately because it would be too boring.
Right. They got to sensationalize at least in headlines, if not within the story. So we all need to be mindful of that and not, make mental leaps and think about getting our kids bone marrow transplants. It's so far away from that it's ridiculous.
Honestly. And that's one of these things where we've seen this time and again over the last 30 years in autism, is one teeny nugget of knowledge comes out of one obscure study showing there might be a link between X, Y, Z and autism, and then suddenly you see hundreds or maybe thousands of families asking for treatment on the basis of that one study that wasn't even a treatment study to begin with. And then once a few people have done it and they believe or they feel like it worked, then they report that on the internet and blogs and everything else, and pretty soon you have a whole country of families asking for a treatment that's never been researched, and we don't even know if it's safe.
Right.
So I would like to say to your viewers very clearly, do not go and ask for bone marrow transplants for your child with autism. This study does in no way justify doing that at this point.
Okay, absolutely important for us to know.